Hi, Tony Selzo here. Welcome to Zipline. You know, what is really going on in this city of Indianapolis is really transforming the whole United States. And the federal government, the actual CIO of the government, called Indianapolis the Silicon Valley for healthcare information. And that really got me going about 2 years ago. And what we've really seen happen and what we've been able to do is build a network nationally of some cutting edge companies that are just doing some incredible things in a very volatile market. And Rochelle Glassman today with United Physician Services is on our show today. She is one of the foremost experts in the entire nation. Rochelle, tell us how you got into this industry, how you got into this business. Where did your business come from?
So obviously you can tell by my unique accent that I wasn't born in the United States. Yeah. So my career started as a clinician, as a nurse in the United Kingdom, trained there in the National Health Care Service, and then left that environment and opened a clinic, a laser clinic for GYN and dermatology services, initially in Harley Street in London, very famous street address. And then after that, relocated that business to St. John Street, similar private medicine street, but in Manchester, where I was born and where I'd lived before I emigrated to the United States.
Okay.
I became runner-up to Businesswoman of the Year in the UK at the age of, I'm not sure now whether it was 24 or 25, but a long time ago. And my business grew very quickly. And I decided to move to the United States because obviously hard work in the United States pays off. So I came here and started my career all over again as a medical assistant, earning $7.50 an hour because even though the United Kingdom and the United States both speak English, in clinical terms, things are very different, and especially in the healthcare arena in the 80s and 90s.
So you really reinvented yourself here.
Yes, I did. I came here and took my, challenged the boards for my nurse's license, and then I was very fortunate. I was given an opportunity to work with the two founders of the HIV virus. And that sort of was my initial claim to fame. I took a 4-physician practice and grew it and brought in all the subspecialties. I was the first person in the United States to actually do an in-physician practice IV center. So before all the oncologists were putting these chemo clinics together in their office, I was forced to do that because in those days, no one would treat the HIV and AIDS patients. So we made sort of a patient care home, and that's where Obama is going right now. In the late 80s, early 90s, we created a multi-specialty group strictly for the HIV population. So whether you needed to see a family practice doc or an internal medicine or an infectious disease GI doc, you would come to the same facility and be seen.
So you've been pioneering really the bleeding edge of healthcare here for 2 decades?
Yep.
Wow.
I would say that. And so I traded basically taking care of patients in my clinical role to, I guess, taking care of physicians and, healthcare business people.
It's because this evolution that you got to see, healthcare was going through a concurrent evolution at that time, and you saw the pain really moved for you, right?
Correct. And then obviously in the early 90s, I think capitation came in. And when that market, there was a huge market shift, especially in California, where at that time I was based out of. And so obviously I didn't know very much about cap. I went as that's how I got into consulting. I was recruited by the president of Cigna Healthcare of California.
Oh, wow.
And he asked me to come in and develop a team for them to create a 24-hour work comp regular healthcare system under a capitated payment model.
Wow.
For the entire state of California. So that was a pretty big jump from building a multi-specialty group to doing a statewide project.
Rochelle, is it fair to say that was probably the first accountable, real care movement in the U.S. at the time?
It was the first movement under the Knox-Keene legislation at the time. Yes, because we were involved with the government and actually putting the entire business model together.